Hello, my name is Frank Pugney, and right now, doctor, you are potentially losing about $100,000 a year or more by writing prescriptions for physical therapy and then referring your patients to someone else's clinic. I would like to show you how to keep that revenue and provide enhanced ancillary services for your patients. Your facility right now has the means to provide integrated physical therapy on a one-on-one basis, about the size of a patient treatment room. I can provide you with all the appropriate equipment, a fully trained, specialized therapist to provide one-on-one quality care for your patients. I created and developed this program because I was really unhappy with the way outpatient facilities were treating patients, one therapist treating 2 to 4 patients at a time. It took me about 3 years to put this program together, and now I would like to offer it to you. All that is required is to have 2 to 3 patients a week, or basically 10 patients a month, that need integrated physical therapy. Conditions treated: bursitis, tendinitis, headaches, neck, back, and shoulder pain, sciatica, tennis elbow, carpal tunnel, basically anyone that's in pain. Most musculoskeletal disorders can be treated appropriately and effectively. What I'm going to provide for you is all the appropriate equipment necessary, plus a specialized, highly trained therapist to provide quality care for your patients. One-on-one integrated physical therapy works so much better than having one therapist treat 2 to 4 patients at a time. You don't have to take my word for it, just listen to what some of my patients have to say.
On a one-on-one basis that Frank Pugney uses, the care is 1,000 times better, 1,000 times better.
I like the fact that we're in a private room together. It's comfortable, it makes you feel not self-conscious.
I think this facility has a lot to offer, and I've told a number of people about it because it is, it has everything in it. It has everything that can help to get to the heart of the problem and knows how to work it out.
I was at the Mayo Clinic and spent a couple of years in California. I tried to find the best sports medicine doctors I could find.
Well, I've been to a much larger facility, and you know, there was a long wait in the waiting room, and then you went into a one room to do one treatment and another room to do another treatment.
The room itself was a big room, and there was equipment and stuff in there, but there was maybe 3 therapists working on about 15 people.
The total time in their therapy that they called it was maybe 20 minutes, 25 minutes was about the total amount of time I was there. It's like a factory in and out.
15 minutes on an egg timer to do some massage work, and even the therapist told me he couldn't do anything worthwhile on me in 15 minutes, but that's all that they're allowed to do.
I was very happy with the results that came out of the therapy that I received from Frank.
I also did not experience the results there that I experienced with the small one-on-one treatment.
You go in, you get your treatment, very personalized, and then you go. To me, I looked forward to it, I'll be honest with you. I really did.
Trigger point therapy, a wonderful technique. Outpatient facilities don't offer it because it takes time, and it takes one highly trained, specialized therapist treating one patient at a time. With integrated physical therapy, we provide trigger point therapy treatments.
We did some trigger point treatment, and you know, it's something that's, it's one of those it hurts so good type of things, but that really seemed to work well on the area of pain that I had been experiencing in this location.
The neuromuscular work is helping me a lot. It's, I feel it getting into areas that need blood flow.
I found the neuromuscular work to be exceptional and extremely helpful to me personally.
The more I'm moving, the better that I'm feeling.
We did a lot of hands-on neuromuscular work. We could find these pressure points that were really sore, and he worked on those, and I could move a lot freer. I mean, I actually left even after the first session walking so much better than I walked in.
Problem areas that I had that had never been addressed before were addressed in a very comprehensive manner and with really good technique.
Another highly effective technique that we offer is active isolated stretching. Outpatient facilities don't offer it because it takes time and one highly trained specialist treating one patient at a time.
What I didn't get is ever get any treatment on my body that was, I wasn't able to move for some reason. If the little bit they tried to do, I always got worse. So whatever they were doing, I wasn't reacting to it well. And what I'm doing now, I'm reacting very well.
Stretching and that put me, after one treatment, I was a real great help. Was a real great help. The one treatment was worth a dozen in the other place.
I sleep pretty well at nights now, and that's a miracle because I didn't sleep for more than 2 hours for 20 years.
One of the techniques that I found interesting was the stretching of my back, and that seemed to really help.
I am feeling better. It's been 5 months and I haven't had any pain, which is really good. And I think I need to come back for some maintenance because it is repetitive and I keep forcing the envelope and pushing the envelope. And I know that, I need to get some maintenance in. But I'm a happy camper as far as that's concerned. Because otherwise I wouldn't be working, and I do need to work.
Not only will I staff you with a highly trained therapist, but I'm also going to provide you with a number of physical therapy modalities, traction devices, strengthening equipment, home exercise programs, patient education training, all the forms necessary for evaluation, documentation, tracking, and insurance billing. Literally, thousands of hours and a number of years have gone into this very successful practice, and now I can offer it to you. Why send your patients to someone else's clinic when you can actually provide better quality care right there within your own practice? And one of the best parts are, you keep the revenue. So may I suggest that you take advantage of this unique opportunity to help your patients and your practice? Do you really want to let $100,000 walk out the door? You already have the patients, so why not treat them? Just call the number provided at the end of this DVD. My name is Frank Pugney of PTAmerica, and I hope to meet you soon. Have a great day.